Great. Thank you guys for joining me this afternoon for our talk on inflammation. I hope all of you are doing well and looking forward to this short journey with you on this very important topic. So today we're going to be diving into something called chronic inflammation. And this condition is called the silent killer, as it affects a lot of our population, and it is often untalked about. So, chronic inflammation and how to reverse it. And for those of you joining me today for the first time, I'm Dr. Curlita Ashby. I am a classically trained internal medicine physician and recently board certified in something called lifestyle medicine and transitioned to practice that exclusively as a way to use our lifestyle or habits to help prevent and reverse chronic diseases. I've been in medicine a long time, and I've been a healthcare professional for even longer. Started out as a registered nurse, and teaching is one of my passions, and I love to be able to do that with the topic of health. In lifestyle medicine, we use nutrition, exercise, toxin awareness, stress management, the importance of sleep and healthy relationships as the pillars for what can give us health or what can take it away. And today, the main topics that I'll discover with you on chronic inflammation are general definitions, how to test for it and know you have it, how to find out, and then the first few steps in lifestyle medicine on how to reverse it using food. As we talk today, the purpose of our communication is completely educational. It is not intended to diagnose or treat any medical condition. And I would encourage you to have a really good relationship and consult your own physician for all health-related questions. This was the cover of Time magazine back in 2004. Can you believe this was already a front page topic on the Time, the secret killer back then? It almost seems like it's taken the background since then. Almost 20 years later, we're still talking about it as something that's simply in the background. So the reason it's called the secret killer is that it itself accelerates other diseases that are then blamed for the killing. So there are links between inflammation, accelerating heart disease, cancer, Alzheimer's, as well as many other conditions. Today, I want to make the distinction between chronic and acute inflammation. When someone stubs a toe, has an acute infection from a bite of a spider, or has an acute gout attack, the toe gets red, inflamed, hot, painful. It swells up. It is supposed to happen as an acute reaction to the trauma. It's a good thing. The body's responding in the appropriate way to bring in the defensive cells that will help to completely resolve the local intrusion. That's the case of acute inflammation. This can also happen at small levels when people exercise in specific joints, for example. It goes away completely with appropriate treatment or even icing. Those types of inflammation that are called acute don't last any more than at most a few weeks. Once you have inflammation like that, that goes maybe to a low to moderate level and then starts to last over 6 months, then we're talking about the realm of chronic inflammation, which is the concern. That we call the check engine light being on in the body. And this is the type of silent killer that is the concern because that check engine light that is on oftentimes is not recognized by the host or the person suffering from it, other than maybe having some aches and pains, but that silent killer is accelerating major conditions and bringing about death much sooner. So chronic inflammation, in that article in the Times back in 2004, was significant. And today it continues to be significant. These are some of the quotes from the World Health Organization about chronic inflammation. It's the most significant cause of death in the world. The World Health Organization calls chronic diseases the greatest threat to human health. And inflammation is anticipated to increase persistently in the next 30 years. In addition to the heart, the brain, and the joints, there's also diabetes and chronic lung disease that are exacerbated by chronic inflammation. What exactly are we talking about when we say chronic inflammation? What exactly is happening in the body, in the cells? Well, there is something there in the body that is causing the immune system to have a response, and that response is called the inflammation. But the immune system never gets a chance to turn off. And so it's continuing to act as though it's being attacked for 6 months or more, and for some people it's years. So the immune system responds to an outside agent or foreign antigen, a cell, a part of a virus, or something that is intrusive to the body, is by releasing cytokines. Cytokines are compounds that are known by names and are identified as pro-inflammatory. They cause inflammation. So some of those cytokines include interleukin-1 and TNF-alpha. The problem is when the body and the immune system is producing these inflammatory cytokines, they continue to injure the lining of the arteries, which is called as the endothelial cell. And if you were in some of my cardiology or cardiac heart health talks, you know that endothelial cells line the vessels of our arteries and are very delicate and can be injured very easily. When there are inflammatory cytokines being produced by the body, which perceives itself to be under attack, those cytokines in turn cause the damage to the lining of the arteries, causing other problems. Other ways that inflammation accelerates aging in the body is by causing oxidative stress and mitochondrial dysfunction. The battery of a human cell is the mitochondria. So when the battery is going awry in the human cell, the person ages, the host ages. And so accelerated aging is something that you see often with inflammation that is chronic. There are many other pathways that have been studied and clarified in science about how inflammation affects the body at the cellular level, but those are the key ones. So you also see increased oxidized lipoprotein, and those are things that can be measured. Lipoprotein are certain cholesterol types that have lipo, fat, and proteins in them. And if something's oxidized, it means it's rusted, it's not healthy. So inflammation is an environment that easily causes our cells, our proteins, our cholesterol to get oxidized, which you don't want. And so one of the other parameters is increased homocysteine is often seen in an environment that has high inflammation. So science has already delineated the very specific pathways in which people have inflammation that is measured, and damage can be accounted for by the increased inflammation. At the level of the arteries, this is a cross-section, really, picture of an artery. If this is the inside lining, that's the outside lining, and the blood flow would be happening here. We see different areas that the inflammation markers can give us a clue as to what's happening in the artery. So the process of atherosclerosis, which is clogging of the artery, is driven by inflammation. And we have the ability to measure inflammatory biomarkers like oxidized LDL, hsCRP, F2 isoprostanes, And when someone's having a heart attack, even those types of tests like the troponin, all of them are part of the test that can tell you where on this continuum is the inflammation happening in the body. So inflammation accelerating heart disease is very well known and very well established. If there's heart disease, it's important to know if there's inflammation behind it, because that heart disease is even more dangerous in the setting of inflammation. So what other conditions or symptoms might be associated with this? Most people, I think, when I mention the word inflammation, they come back with, yeah, I think I have it because, and they hold a joint. I have a body pain in the joint. That's possible. Oftentimes there is actual bone degradation or a tissue damage, a structural abnormality from an accident, or repetitive motion injury from a tennis player's elbow, for example, that's caused actual breakage or osteoarthritis or structural damage that then becomes inflamed for other reasons that the body is inflamed. But people don't get the type of inflammation that we're talking about from having a broken joint. That doesn't literally lead to total body inflammation. But if the person has total body inflammation, one of the places it can stay and remain and express is through abnormal joints and in other areas that are compromised. So more common and related to chronic inflammation are the symptoms of fatigue, depression, mood disorders, gut abnormalities, weight fluctuations, and frequent infections by way of the immune system constantly having to produce these cytokines in response to an agent that is never going away, that's causing the body not to be able to clear infections and stay immune. So do you know your inflammation level? How is this measured? And what are the ways to know if you have a small, medium, or large amounts of inflammation? Let's get into that now. Measuring inflammation is very important, especially if there is a chronic disease like diabetes, high blood pressure, cholesterol, heart disease, any of the major conditions. If they happen in the setting of chronic background inflammation, it's important to know because both conditions, the inflammation and the other condition, have to be addressed. The way that some physicians, and myself included, measure inflammation include a number of tests. Okay, one of the most common and most sensitive one is something called highly sensitive C-reactive protein. Some of you might recognize CRP as a usual inflammation test that is done in most offices. C-reactive protein. It's a protein that the body produces when it is under attack and is under a lot of stress. And it can be very high in the setting of infection. But when there's no infection, but you're looking for that low-grade background check engine light on chronic inflammation, that's the silent killer, you want to look for some of these values. And I check for, in that case, highly sensitive CRP, which can be high even when the regular CRP appears to be normal. So this is also a type of test that gives you an indication that there might be damage at the level of the cardiovascular system, because remember, the lining of the arteries get damaged by inflammatory cytokine. So when hsCRP is high, we often are concerned about cardiovascular disease as well. Oxidized LDL, remember I said inflammation has a tendency to make certain proteins rusted. Well, we can directly measure oxidation of the LDL, for example. We can measure the health of the lining of the artery through this test called ADMA. We can measure insulin resistance. If someone has a very high amount of visceral fat that is inside the organs, that fat is active metabolically and does increase inflammation. So if that visceral fat is high, it is likely that there is a source of inflammation from that fat. So these are all the different ways that a physician or healthcare provider could help someone have a clue about their background inflammation if they are tested. But I have to say that these tests are not normally run. When I was a regular internist, I don't think I ever tested any of these. And so as a consumer, I think the patients are becoming more aware that there are more nuanced ways to figure out chronic conditions that can be reversed a little bit earlier before the diseases progress. And those inflammatory markers that we just went over are the ones that are on the continuum here when inflammation and atherosclerosis is worsening. So it might start here with some oxidation, and as plaque grows, there are more and more markers of inflammation. When there's rupture of the arterial lining, the inside lining, you have other types of more serious inflammatory markers, all the way to the heart attack when these are tested in the hospital. So when we look at the results of the inflammation markers, we also get a clue of the progression of disease or how far someone is along the cardiovascular disease route. So why are some people inflamed and others not? We blame age a lot. I would say, even though age is here as one of the conditions of inflammation, not everyone who is aged has inflammation. So it's not an automatic, you're older, you have inflammation. However, as someone ages, there's often that battery, which is in the cells, the mitochondria, can begin to have some dysfunction. As someone gets older, because of their exposure to the sun, the elements, there might be some free radical exposure and accumulation over time. Maybe their antioxidant levels haven't been the best throughout their life. They haven't been taking care of that machine that is their body. So you have more accumulation of oxidation, unrepaired cells, damaged mitochondria. And so you tend to see inflammation in bodies that have aged without the proper care. So obesity is one of the causes of inflammation directly because certain fat tissues actually produce inflammatory cytokines. The fat tissue that is called visceral fat is metabolically active because it secretes cytokines. It secretes inflammatory cytokines. So the higher the BMI, the more cytokines are secreted. Certain diets actually directly cause increase in inflammation, and studies have been done where someone might be given a processed meal and those inflammatory cytokines like IL-1 and TNF-alpha, those are measured. They measure very high after a particular meal. That same person could have a bowl of blueberries in the next meal, and those same level of cytokines, inflammatory cytokines, are seen to be blunted. So each meal can have an effect on the level of inflammation of the person in that moment. So diet is a very key factor that we can use to help inflammation, and that is also used by some of the population to increase their inflammation, maybe without their knowledge. Smoke and toxic exposures goes without saying. If we're having damage, smog, literal smoke, that does increase inflammatory molecules in the body. This is an interesting one, that low sex hormones actually are correlated with high levels of inflammation. This is not because they cause high inflammation, it's because they're actually a healthy hormonal balance body is better able to fight inflammation. So it is helpful when the hormonal system is in balance because it helps as an agent to help against inflammation. So stress, whether this is physical stress from the gym, which is transient and self-corrected after you rest and recover, or emotional stress that continues on and on, financial stress. Anytime someone's under stress, we know there are hormones that are secreted. Some of those hormones include cortisol. And as a result of the hormone secretions from stress, you can also have cytokine release that increases inflammation. This is directly measured. Stress is a very important component as a cause of inflammation. Sleep disorders, independent risk factor for inflammation, especially when we talk about sleep apnea. The body is only able to repair during sleep. That's literally when we put the body in the repair shop. And so if that sleep is disrupted and person's not even getting oxygen, maybe by way of apnea, and stopping breathing hundreds of times during the night, the body never has a chance to really enter that deep restorative REM sleep that allows for the fixing of free radicals, for example, abnormal proteins, and repair other things that the body needs repairing. So this is the reason why inflammation can worsen any other condition almost. Because if the body itself is not able to help itself, and these other conditions need the support of the body, which is not functioning, then they will progress. So aside from diet, exercise, obesity, stress, and poor sleep, I'm going to mention a few other less known about agents that cause inflammation. You see that windowsill with the mold? Well, that's considered a toxic exposure. The body will have a reaction to the mold once it is in. Same thing with mercury or pesticides. When those are taken in, if the body has a hard time clearing them, they can become chronic insiders of the immune system, which puts the body in a constant inflammatory state. Same thing with certain infections that aren't cleared completely from the body, like tick-borne infections, for example, or certain viruses that the body is not able to clear. The more the immune system sees those particles as something it needs to fight, the more it maintains this perpetual state of fighting, which is an inflammation. And being in that inflammatory state by itself is running of the engine without any direction. So the body ages very quickly. When it doesn't have the vitamins needed for repair, it can also be a cause of inflammation. So a word here about obesity, because sometimes in the environment of body positivity and inclusion, we have to remember that actually fat, when it comes to visceral fat, it is a health issue, because they actually do produce inflammation, increase oxidative stress, and increase insulin resistance. And so some of the fat under the skin that changes the shape of someone is not a problem, it's just cushion. But when it comes to visceral fat, which we'll see in a few pictures, that fat secretes what we call cytokines, and so we call it metabolically active, and it's part of the disease conditions that increase inflammation. I mentioned visceral fat a few times. It's the fat that's under the muscle. Let's say this is the abdominal muscle. Visceral fat is inside the organs. As exemplified here, this is a heart muscle, and there should really not be a lot of this fat around the muscle. That's visceral fat that found its way there. When people do have what's called liposuction, the procedure takes out this subcutaneous fat that's right under the skin. As we can see, it's going through under the skin, coming to the fat and stopping at the muscle. So liposuction does not get at the visceral fat here, which is the main problem. So someone can look good and still have visceral fat that is causing illness in the background. We call that skinny fat. So obesity isn't the only condition for having visceral fat. And I encourage people to know if they have visceral fat or not. So less common causes of chronic inflammation include some viruses which people may get as they're young, maybe a tick bite from walking in the woods as a Boy Scout, and then later have chronic infections, perhaps from Lyme or other microbes. The fact that the body never clears this bacteria, fungi, and other parasites is the reason that the immune system continues to fight in the background against them. And the same happens when someone is exposed to silica dust. The body continuously is trying to wall it off, to clear it, and that inflammatory system is on perpetually. Same thing happens in heavy metal toxicity and some autoimmune conditions, for people who are eating things they're not aware that they're sensitive or intolerant of, continuously annoying and attacking the immune system to respond is the antibodies produced, and that's called the autoimmune disorders. So a couple of resources for you to dive further into this topic of inflammation. These two books are written by physicians, MDs, and they have a lot of insight on different aspects of triggers and tools to help you understand a little bit more in depth about inflammation. Let's talk about the solutions now. And this will be fun because it will be things that each of us can do at home right now this week. Reversing inflammation with food begins with a low glycemic diet. Low glycemic diet is simply foods that will not have a tendency to spike the blood sugar. And if someone Googles low glycemic index diet, it'll be very easy to find that it's mostly nature-made foods, fruits and vegetables. Within the nature-made foods, there are some foods that have a little bit more ability to spike the sugar than others, but overall that group is a much better group to stick to than any packaged food, for example. So greens, vegetables, those are going to be high in antioxidants and flavonoids. Garlic and quercetin are known to lower inflammation, and those can be found in food, and they can also be supplemented. I mentioned anything that's packaged will be considered high, and within the low glycemic index, there are variations, so you can be very specific with your choices. This gives you an idea of what the glycemic index might be like. Of course, white rice, when you compare that with maybe a banana, the white rice may spike the sugar a little bit more. The banana has a little bit more fiber in it. High fiber foods are great for inflammation. Okay. And this is any type of fiber, both soluble and insoluble. This particular nutrient has been shown to lower the levels of interleukin 6 and TNF alpha. Fiber, generally, the average American is getting about 10 to 20 grams, and you want to aim for 30 to 60 grams of fiber daily. This not only helps inflammation, but also heart health, as some of you will know. Nuts and seeds reduce inflammation. Almonds in particular, we know has the cardiovascular and diabetic benefits. But in this case, walnuts and Brazil nuts, as well as pine nuts, are actually documented to be anti-inflammatory. So if you don't now have a Brazil nut in your morning or daily smoothie, that's something that is easy to implement that can help you reduce inflammation with just a few little discretions in how you eat. So green tea, excellent for weight loss, but these polyphenols that are in there as well are excellent antioxidants. We see studies that show reduction in the CRP. Remember, one of the tests I mentioned was the C-reactive protein. Well, those polyphenols in green and black tea are known to reduce C-reactive protein. Spices like curcumin, this is a constituent of turmeric and has multiple health benefits, one of which is inflammation reduction. And if you in the spices, there are a few here listed that are anti-inflammatory, including ginger, cayenne, cinnamon, basil, and cloves. continuing with the foods, how to incorporate certain things that will help. And luckily, many of these foods that I'm mentioning for inflammation happen to also be heart healthy by way of improving the health of the lining of the arteries. One of those things is omega-3 fatty acids. These are a few of the ways you can get omega-3s, obviously in fatty fish, but if there's a vegetable, a vegan diet in flax, hemp seeds, avocados. Normally, if fish oil is extracted from a very healthy fish that was wild caught, that oil will be rich in omega-3 fatty acid. We used to assume that fish oil would have very high source of omega-3, but with the advent of a lot of farming of fish, it's been found that their flesh and the oil that's produced from them may not be as concentrated as some of the others previously were. So just know that you need the active omega-3 if you're looking for that in the fish oil or in the fish or in any other foods. That's what you're looking to improve. The omega-3 is known to decrease CRP, IL-6, and TNF-alpha, all of which are associated with inflammation. So if you needed a soup, something simple after today's presentation to try to start somewhere, and you want one ingredient and one ingredient only, go for a mung bean soup. And if many of you don't know mung bean yet, then today will be our introduction to mung bean. This is very well known in the East, and particularly this food is rich in flavonoids, and they're broken down the different types of flavonoids. And it is very, very, very tasty if you cook it right and get some good recipe, and it is anti-inflammatory. So some of the foods are important to know, as well as some of the nutrients which the body might need to help fight off infection. Now, if you are eating an excellent diet and you do a micronutrient check, you can test your actual nutrition by doing a micronutrient test. You can know whether you have everything that the body needs. But let's say you don't know, or you do a test and your micronutrient levels aren't where they should be. And micronutrients, by the way, are vitamins and minerals that the body needs for its healthy function. So if it doesn't have some of them, it can conduct some of the anti-inflammatory processes that it needs. Magnesium, vitamin D, vitamin E, zinc, selenium, all of them are part of this group of micronutrients that the body needs. In particular, some awareness is improving now about the utility of magnesium for many, many reasons. Zinc, many recognize its importance during the COVID in the last few years, and selenium, they all act as antioxidants in the body. So in your dietary factors, wouldn't you know that magnesium is listed as one of the most anti-inflammatory dietary factors? So, and we know which inflammation markers it helps to decrease. So you can make sure to have the daily recommended 400 milligrams if you're wanting to make sure you're getting enough magnesium. And if you don't have a way to test your magnesium levels to know if you have this in a dietary supplement or through your food, then you can be sure to have 400 milligrams and count it a day. So finally, just a couple more things that we don't often talk about. A lot of people with heart disease often stay away from a lot of oils, with the exception maybe of avocado, which they cook with, or olive oil that they drizzle on salads. The sesame seed oil actually reduces inflammation and is notable here because it has the benefit of not only reducing inflammation markers, but it stops some of the processes before they even begin. It stops the making of prostaglandin that would then go on to making the pro-inflammatory agents. So sparingly in some of the recipes that you might find that are Eastern in variety, if it calls for a teaspoon of sesame oil, you're probably not doing yourself in by having increased inflammation with any other seed oil. It's probably helping. So this here is a list of other items that people might recognize as anti-inflammatory, like N-acetylcysteine, milk thistle, whey protein, glutathione boosting agents that help fight inflammation. Pycnogenol is a French maritime pine bark, which in the natural world literature has been shown to not only decrease inflammation, but also work as an antioxidant. And so we find that in some formulations on the market. And to bring it home in terms of the vitamin, we heard a little bit about magnesium, but there are a couple of vitamins I want to highlight today, both E and D, for their suppression of prostaglandins, which are the precursors of inflammation. Vitamin D, you definitely want to have that. Everyone knows that now. And the levels should be between 60 to 80 if you're able to maintain that level. And maintain the vitamin E as well, and the selenium, which we talked about. So how do you add all these different things? You know, everything that we need is on the planet. We're not going to other planets to pick up minerals. They're all here. So how do you put it together for what your body needs? You know, this ancient knowledge was passed on in cultures and through some traditions. A lot of the ways to incorporate these different things in daily food has been kept, but somehow we really got a little bit disconnected with the advent of our technologies and the fast food industries here. I like to use this chart because it's a way to bring things together and help keep us organized on what the priorities are when we're making any meal. This is going to be for the anti-inflammatory. Let's say a smoothie that we will make. We'll start with water. We'll add the greens. We'll have some fruit, maybe the berries that we know are anti-inflammatory. And maybe we'll put in here the whey protein or the pea protein. Maybe over here as well could be some of the chia seed if someone likes that, or the flax, the ground flax. And there might be a Brazil nut at this level. And here the person might add curcumin or some turmeric, whichever form that they have. And maybe even a couple other spices, maybe cacao or some of the medicinal herbs. There's another one that I think would be really great in a smoothie that will come back to me, but I think it'd be great to add it in here. So this is one meal. The same chart can be used to build a wrap, to build a soup, to build a bowl, any form that you tend to gravitate towards as far as breakfast, lunch, and dinner. It would look different because maybe you want to have a smoothie in the morning and a wrap in the afternoon, or maybe a bowl on the go. But the organization of the contents of the meal would still be the same to help you gather together the different components that are needed for the anti-inflammatory diet. In the smoothie that I just talked about, ginger, haritaki, those are a few of the other spices that I was wanting to mention on the other slide. But ground flax, chia can make it a little bit thick. But if you do have a variety of fruits, each day could be a different type of flavor. You could have some frozen berries one day. It could be papaya another day. You could be all green another day. You could try dates and beets. So there could be variety in the smoothies that are produced, but the core few ingredients, the greens, the colors, then the protein that is pea form or whey form, and then the berries, the nut, the actual nut, the selenium nut, and the milk can be added. So this is not anything radical, thankfully. It's just strategic and, you know, a great, I would say, mentor to many who lived here. Jim Rohn, he always says things that are easy to do. When you look at it, it's like, oh, this is not spectacular. This is not a great big kept secret. It's in plain sight. Yeah, it's easy not to do as well. And obviously, most Americans are not doing this. So what it seems easy, it's easy to do and it's easy not to do. So diet high in plants, moderate fruits, nuts and seeds, high fiber, high omegas, curcumin or some other spices that you like daily, vitamins and micronutrients. If you check off all these boxes every day, you're on your way. So we've concluded with the food. I'll say a mention about a couple of other types of lifestyle solutions that help with inflammation. Regular activity is anti-inflammatory. There's an actual active acute inflammation that happens while someone is exercising, which is normal. But after that immediate recovery, let's say you ice and go about the day, there shouldn't be lingering inflammation from the exercise weeks down the line. But that stress that the body has gone under during that time, the physiology changes to the point where the body is able to repair. The immune response is improved. So when muscles contract, the muscles actually release anti-inflammatory cytokines. You actually counteracting inflammation during exercise. So even modest amount of activity is a way to combat inflammation. So when do you know your inflammation is fixed? Let's say you get the slides, you become meticulous, you decide on your 3 or 4 meals that you're going to have a day, you plug in your easy to do and easy not to do anti-inflammatory tidbits in each of your meals. Well, wait 3 to 6 months and recheck one of those inflammatory markers. If it's working, if the lifestyle system that you got is working, it will show in your lab. And if it doesn't, after changing or improving your nutrition, then other questions can be asked. For example, is this due to a virus that my body's not clearing, or a tick-borne infection, or mold, something like that, that may be more persistent and not necessarily food-related. So this is why most causes of chronic inflammation are from lifestyle, and this is why most chronic inflammation are reversible with lifestyle changes, which is good news. So in conclusion, inflammation causes accelerated aging, poor aging, in fact. So high levels of cytokines not only cause a lot of debility physically, but it also causes neurological problems and even Alzheimer's disease. Literally addresses Alzheimer's disease. I haven't begun our talks on Alzheimer's, but this is a condition that is now being referred to as type 3 diabetes because of its roots in metabolic illness and metabolic dysfunction. So high levels of inflammation under any metabolic disease is going to make that disease worse. Also, elderly people who stop being active for whatever reason, they're not getting that benefit of anti-inflammatory daily. And of course, we know with less activity, it becomes a vicious circle, and people might even eat worse and feel worse and not be able to exercise because they feel bad. And so you get down a bad spiral. So start somewhere. The steps are small, as you can see, and they're easy, but you do have to continue to stack them, and the lifestyle has to eventually transform and stay transformed for a while so that the end result is a level of inflammation that is measurably lower. And we do this in my practice, and I enjoy seeing people's inflammations come down and their smiles when they've achieved it by doing really very little, but staying consistent with that. So stop the food poisoning if that's your issue. I didn't say in particular any specific diets, but whether you're vegan or Mediterranean or any other name that you like, doesn't matter, as much as it's something that you'll stick to and has the framework of that pyramid that we just talked about. the new plant food pyramid. So how good is your nutrition? If you don't know, get it checked. There are many ways to measure your nutrition. I mentioned some micronutrient testing. I mentioned antioxidants that you can check, your vitamin levels, your inflammation levels. Of course, if there's disease, then you know you need to look further. But check to see if your nutrition is doing what it's supposed to be doing for you. Blood work is one way. You can check your vitamin levels. You can check your diseases. Scanning or testing by hair is another. I have one of these scanners in the office, and sometimes it's helpful to see if people are actually getting in their antioxidants through their diet. This measures the level of carotenoid in the skin. And if you're eating it, it's expressing through your skin, eyes, hair, nails, everything. So your nutrition is literally coming out of you, and it can be measured. So an oxidative stress is what that scanner measures. And if there's oxidative stress, cells are dying. They're getting oxidized. And so you can know where you are, and that relates back to nutrition or poor supplementation or a lifestyle that is unhealthy. So in summary, inflammation needs to stop in the background of any chronic condition, and it is known as the secret killer, has been on the cover of Time magazine since 2004. And still to this age, it still seems to be a secret. It is preventable and reversible. It can be tested, so you don't have to guess. Fortunately, lifestyle choices affect most people's inflammation levels, and it can be reduced or reversed with lifestyle. I want to thank you for your attention, and I'm looking forward to your questions.